Hi everyone, welcome to Sonography. Today we are looking at right lower quadrant case study, which is appendiceal abscess. A 24 years old male patient present to the emergency department with acute worsening right lower pain accompanied by fever and vomiting. He also gave the history that 3 weeks ago he had severe pain in that area but somehow leave and now it started again. Clinically, this points straight to the acute appendicitis, but when we place the probe on right iliac fossa, the sonographic presentation reveals that disease has already progressed to the major complication. So let's look at the images, what we got. By using high-frequency linear probe, scanning adjacent to the cecum in right iliac fossa, we immediately identify a well-defined, complex, and predominantly hypoechoic fluid collection. It measures about 5.2 into 4.3 centimeter. Notice the texture inside the collection. It isn't clear fluid, it contains low-level internal echoes and purulent debris. When we apply color Doppler, the collection shows an absolute absence of significant vascularity, confirming it as appendiceal abscess. As we trace the right iliac fossa, the appendix itself is not completely visualized throughout its entire length, which is highly typical once perforation and the tissue breaks down. However, a small suspicious area is faintly visualized sitting in close immediate proximity to the abscess pool. Likely it is the tip of appendix. Surrounding the collection, notice the bright hyperechoic zone. This increased echogenicity represents intense inflammatory changes in the peri-appendiceal fat, commonly known as mesenteric fat stranding, as the body attempts to wall off the infection. Now let's summarize all the findings for this case. A well-defined, complex, predominantly hypoechoic fluid collection measuring about 5.2 by 4.3 cm noted in right iliac fossa adjacent to the cecum. This collection shows internal echoes or debris and no significant internal vascularity seen on color Doppler. The appendix is not completely visualized in its entire length. However, the tip of appendix is faintly visualized close to the proximity of aforementioned collection. There is also increased echogenicity and inflammatory changes of the surrounding peri-appendiceal wall consistent with fat stranding. And at the last for impression, appendicular abscess in right iliac fossa. Thanks for watching. Please like the video and subscribe to Sonography for more videos.